So I'll just make a brief introduction. Good evening, everybody. My name is Patrick McKeown, and Vikki Jones and Jackie are going to present with you on long COVID. I think it would be a very interesting presentation. Long COVID is very much going to be affecting the autonomic nervous system, or the autonomic nervous system is affected in long COVID. And the whole objective of breathing exercise is to help to bring balance. So in terms of very often with breathing, when it's a tailored approach to the individual, it can be very effective in terms of helping the individual deal with stress and anxiety. And it can also be very helpful in terms of improving sleep quality. So there is a way for the body to tell the brain that the body is safe. And when there's dysregulation of the autonomic nervous system, that comes with its own stress, both a physiological and a psychological stress. And it's very important for the body to tell the brain that the body is safe. And when the brain interprets the body as safe, that can then, pave the way for some progress to take place. Vikki and Jackie both are recovering, working on their own recovery from the condition. And that's why they're in a much better position in terms of talking about the application of breathing and their journey. And I'm going to pass you over to them. I'll have my camera switched off. So the best of luck to you both. And for everybody else, thanks very much for joining. And I hope you get something helpful for yourselves out of this presentation. Thanks.
Thank you so much, Patrick, and to everyone at OA for inviting us and hosting this. Just 2 seconds of Zoom housekeeping before we kick off properly. If you can keep yourselves muted, that would be wonderful. We'll have an opportunity for questions at the end. And as you've probably seen, this is being recorded. So all the stuff that goes along with that. Sorry, I'm just letting somebody else in. So yeah, very warm welcome. And on to slide 1. Who are we? So my name's Jackie Baxter. I am recovered from long COVID. It took me quite a long time, but I did get there in the end. And breathing was one of the most important things that helped me with that. In fact, it was the first thing that I found that helped. So it took me just over 3 years. What was interesting for me was, as I learned more about breathing, that actually the story didn't start with COVID. I was probably a dysfunctional breather before I got sick. Obviously can't get in that time machine and find that out for certain, but I'm pretty sure. Many of you may also know me from the Long COVID podcast. So if there's any listeners out there, thanks so much for coming along. I'm going to pass over to Vikki.
Well, thank you everyone for joining us. And my name's Vikki Jones. My first thank you goes to Jackie, because without her, wouldn't be able to put these things together, but also to thank Patrick, because he was the first professional that was curious enough to listen to me when I was struggling with long COVID. And through his breathing exercises and talking to him, Jackie and I have been able to put together this presentation. I've had or still have long COVID and have been on this journey for 42 months. And it has been a very difficult 3 years for me, struggling with all sorts of symptoms. And like Jackie, I now know that I was a dysfunctional breather prior to getting COVID, but that has changed now. And even though it's been a difficult 3 years, the silver lining is that I couldn't do what I'm doing now. I couldn't be sharing this information if I didn't have the lived experience of long COVID. So I'm still walking in the shoes that you're walking in. And like I said, this partnership with Jackie and teaching the long COVID breathing courses are the silver lining. It's given me purpose. It's given me passion. I love helping people. Jackie and I love researching this, and it is really fulfilling to me to help other people. So when Jackie and I do our classes, we always start with a little bit of breathing just to relax people. And one of the important, the pillar of our breathing sessions is nasal breathing. So I'd like to invite you just for a few minutes to experience nasal breathing if you haven't done it before. So the first thing I'm going to ask you to do is to sit up straight. And just to make you aware of how important your posture is when you're breathing, I'd like you to stick your head forward and your neck forward, and then rotate your head to the left, and then rotate your head to the right. And then you are going to find a good posture. So think about your head reaching for the sky, and your chin is off your chest. And then do that same exercise. So rotate your head to the left, and then rotate your head to the right. And you will find that you have a better range of motion when you are in the correct posture. And that's something that we focus on during our breathing exercises, making sure that you are sitting or laying correctly. So now what I'm going to ask you to do is close your eyes, relax your shoulders, and just reduce some of the tension that you have in your body. And take your hand and put it on your chest. So as you do an inhale and exhale through your nose, I'd like you to think about not moving that hand. So allowing the air to go into your belly and not in your upper chest. So keep that hand there as an aid, as a guide, so that you're focusing on your belly when you're breathing in through your nose and out through your nose. And in through your nose and out through your nose. So don't change your breath, just observe what is going on with your body. So keep your shoulders relaxed and reduce the tension, and breathe in through your nose and out through your nose. So try to soften your breath and keep that breath quiet as you continue to nasal breathe. So we're going to ask you, just as we go through this webinar, just to check in with your breathing, because often when we get stressed or when we start focusing and concentrating, then that's when our breathing patterns start changing. And that's why we're going to keep you aware of your nasal breathing throughout this little chat. So what do we want to look for? What are the signs that these breathing exercises are having a positive effect on our body? So for long COVID, we really want to get into that parasympathetic state, the rest and digest, because like Patrick said, that is the way that our body will begin to recover. It will feel safe. So when we do breathing exercises that put us in the parasympathetic, what happens to our body? Well, you may feel that there's more saliva in your mouth. Why is this important? Because saliva is full of enzymes, and enzymes help with digestion. You may also find your fingers and your hands and your feet start feeling warmer. Your stomach may rumble, which is also another sign of your digestion beginning to work. And these exercises that we teach, you may feel calmer, you may feel more focused. So you may feel a reduction in your symptoms. Your heart rate may start slowing down. Your breathing may feel less labored. So that's the aim of these breathing exercises. So what we're going to cover in this talk is why learning to breathe correctly makes such a huge difference for us when we are recovering from long COVID. And breathing correctly can change your body's state quicker than anything else. You take 25,000 breaths a day, and just by changing one breath, you can change your biochemistry. It's quicker than food, it's quicker than water, it's quicker than exercise, sleep, supplements, medications, meditation. Just one breath has the ability to change your body and your state. And when we're going through long COVID recovery, when we're trying to allow our body to get back to its healthy state, breathing is a pillar of support. It's been a pillar of support for me, and I know that it has been a pillar of support for Jackie. So learning how to functionally breathe, and also learning which exercises will support that healing. So we're going to just introduce you to a few exercises that we use with our clients just to get you started. We're also going to talk about the importance of getting good sleep and how to get into that pre-sleep routine using breathing. And as Patrick said, that is so important for your recovery. And the other thing, prior to long COVID, I think we were all on the graded life program. And since getting long COVID, we have had to learn to pace ourselves. And we're just going to talk about that very briefly, especially with regards to some of the breathing exercises.
Okay, thanks, Vikki. And I can add to that breathing was a pillar of my recovery. It's also a pillar of my post-recovery, because as I've discovered that actually after you recover, you still have stress in your life. Who would have thought, right? Yeah, right, dysautonomia or autonomic dysfunction. Now, interestingly, if you look at any of the current sort of research, it all leads back to one thing as a kind of, root cause. It all connect back to the autonomic nervous system in some form. So take a look at this slide. I know this doesn't have all of the symptoms of long COVID and dysautonomia on it, but I think it has certainly most of the main ones. So all of these things come back to the autonomic nervous system. And when the autonomic nervous system is not functioning quite right, it's not in balance, then that is when all of these sorts of things tend to go on and we feel terrible. And, interestingly, trauma was not something that I understood for a long time. And understanding actually that the nervous system is very sensitive to trauma, and trauma in turn makes the nervous system much more sensitive. So when we have trauma, which I think everybody with long COVID does to some extent, our breathing pattern changes. So how we breathe. So I'll talk about this more in a moment, but we can either go into fight or flight, or we can go all the way straight down into our freeze. And our breathing pattern will change depending on this. So when we're in our kind of fight-flight state, we're going to get all sorts of things like faster heart rate, faster regular breathing, panic breathing even, shallow upper chest breathing, hard breathing, mouth breathing, and definitely more prone to panic attacks. I had never had a panic attack in my life until I had long COVID. So all of these things. So just for a moment, have a think, and you may not have to think too hard, because again, certainly when I was unwell, this was something that happened all the time. When you are particularly stressed, how do you breathe? And certainly for me, when I get stressed, even now, I tick most of those boxes on the list there. So yeah, here's our autonomic nervous system. So our autonomic nervous system is in 3 different states. So we have our rest and digest. So this is the green zone. This is the happy zone. This is where we want to be most of the time. This is where the body heals. This is where we want to connect with people. So if you feel yourself withdrawing into yourself and away from people, the chances are you're probably not in that green zone. So this is where things like digestion works. This is where our body feels relaxed. And when we get a stressor of some sort, it could be a physical stressor, it could be a sort of mental stressor, like we've tried to read too much of our book. Physical stressor could be anything from walking up the stairs, brushing your teeth, walking to the post box. For people with long COVID, all of these things that we wouldn't have considered physical stressors beforehand suddenly are. But even, yeah, things like answering emails, your kind of emotional stressors, having an argument with somebody. I'm sure many people have experienced that, where you shout at your partner, for example, and suddenly you just flop. So danger, action, red zone, our fight flight, that's where we're going to get fast heart rate. That's where we're going to get faster breathing. And this is not a bad place to be if we're not there all the time. We need this. This is our action zone. This is where if we're walking across the road and a car comes out of nowhere, we got to move. It's the body's sort of survival state. It's a very necessary place. The problem is when we get stuck there. And when we're constantly there, or when we're triggered to go there from something that isn't particularly dangerous, but we are sensing it as dangerous. And a lot of people will go into fight flight, and then the body will just bounce back and you go back into your green zone, and that's great. That is a normal response. But what can happen is that we spend so much time in our fight flight state that eventually the fuse box just flips. So, if anyone's experienced that in their house where a light bulb blows and then the fuse goes, it's kind of where the body pulls the plug and we go into shutdown. And this can be a very difficult place to get out of. So again, you're shut down, you're going to get symptoms like maybe lower heart rate, that absolute bone-crushing fatigue where you just cannot get off the sofa. Things like constipation, and you can get all sorts of depression, really, really common in that state, and it's a pretty horrendous place to be. So why is breathing so important to our nervous system? As Vikki said a moment ago, breathing can change the biochemistry of our body faster than anything else. So it's such an important tool. But using it in the right way as well. So knowing what state am I in, which particular breathing is going to be good for this particular set of symptoms that I'm experiencing at the moment. And also this really is a skill for life. As I kind of said earlier, breathing was such an important part of my recovery, but it's something that I use every day now. So before I came on here, I'm giving a presentation to a whole lot of people online. I'm feeling a little bit of stress. But instead of that stress becoming a kind of vicious cycle of stress added to more stress, added to more stress, I had a few tools in the box, so to speak. So, it's just, a skill for life. Sounds a bit tacky, doesn't it? But it really is.
Before I talk about the difference between your mouth and your nose, we're just going to do a little check-in and see how we're all breathing. So have we continued to nasal breathe? Are we feeling relaxed? Are we feeling calm? Do you have saliva in your mouth? All those little things that we can use as feedback to what our body is doing. So why are we talking about nasal breathing? So when we are a dysfunctional breather, we tend to breathe with our mouth. And the mouth actually doesn't have any functions to do with breathing. The only reason our mouth is there is if our nose is completely blocked and we need to open our mouth to breathe, that's appropriate. But the rest of the time, we want to try to focus on nasal breathing 100% of the time. When we use our mouth to breathe, it drives that sympathetic response, that one that Jackie was talking about, that puts us into that fight or flight, that panting. The mouth provides very little resistance to the breath that we are breathing, and it encourages upper chest breathing because we're not getting that resistance, and it also promotes very fast breathing. So when we're trying to calm the body down, we want to slow the breath down. The other thing about breathing, many of us with long COVID suffer from chronic dehydration. And when we mouth breathe, we actually lose a lot more water through our breath, 42% more, than if we're nasal breathing. It affects the pH of our body, and it also doesn't help our oral hygiene or our mouth hygiene. So those are the things that we want to be aware of why we shouldn't be using our mouth to breathe. We use our mouth to talk and to eat. And the rest of the time, we focus on the nose. So what does the nose do? What are the benefits? There are actually 30 functions of the nose that I learned about from Patrick. Thank you. But for people with long COVID, nasal breathing stimulates the vagus nerve. So there's a lot of research out there that says that long COVID affects our vagus nerve, either with the reinfection or other things. We actually have a direct infection of our vagus nerve with the COVID virus. So by supporting the vagus nerve through breathing, by stimulating it, it is a good way to help our body recover. The nose also promotes diaphragm breathing, which I'm going to talk about in just a minute. And it also slows our breathing rate. So these are your tiny nostrils. And if you can think about moving air through your nose, it will slow your breathing rate, which in turn acts as a pacemaker to your brain. So those racing thoughts that we have, those panic attacks, if we're nasal breathing, we can help alleviate those. And the other thing we know about our nose is it sterilizes our air that we breathe in. It warms the air, cools the air, and dehumidifies the air. And then there is a function that it helps with some of our hormonal symptoms, especially with menstruation and perimenopause. So once again, just check in. Are you nasal breathing? Because that's what your nose is for. So Patrick mentioned at the beginning about the importance of sleep. And there is a lot of information out there about sleep hygiene, about how we should be sleeping in a quiet room and a dark room, and our pre-sleep routine with how we eat and the kind of stimulation we get prior to going to bed, and reducing our blue light. But the biggest thing that we don't talk about is breathing. So one of the ways that you can get better sleep is by changing your breathing during the day. So the biggest influence on your sleep is how you breathe throughout the day. And when you can nasal breathe through the day and also get into a pre-sleep routine with nasal breathing, you will find that your sleep really improves. And that is something that people with long COVID really suffer with. So we either get a massive, we either sleep all day and then we can't sleep at night, or we can't sleep at all. So once again, we're talking about exercises that help with the parasympathetic, the rest and digest, and therefore that goes into producing a good environment for us to sleep. The other thing about sleep is during sleep, we are restoring our body, we're recovering, we're rejuvenating some of our cells. So that's so important that we are getting a good amount of rest. And the things that come along with long COVID, pain, anxiety, inactivity, the overstimulation of the sympathetic nervous system often lead to sleep disordered breathing. So that mouth breathing, that upper chest breathing, the shallow breathing, those are things that we want to avoid prior to, well, we want to avoid all the time, but especially when we sleep. And the exercises that Jackie and I teach for long COVID really promote good sleep. Okay, so now we're going to go back into a breathing exercise. And we are going to talk about diaphragmatic breathing. And prior to long COVID, I actually was a personal trainer for over 30 years. And I never realized the importance of the muscle called the diaphragm. And it's something that we don't think of to train. But one of the things that we say as personal trainers is if you don't use it, you lose it. So the focus on diaphragm breathing is focusing our breath and using the diaphragm muscle. And that's why I like to say it's actually the most important muscle in your body. And when we are sitting a lot, when we are laying down, or when our activity level has changed, then our diaphragmatic breathing that we get with long COVID suffers. So it's definitely an exercise that Jackie and I focus on with our clients. And you can do it sitting, laying down, or walking. It's a great exercise to do because once again, it down regulates, gets you into that parasympathetic. So the other thing that we see with people with long COVID is we suffer where your diaphragm is connected to your emotions. So a lot of people with long COVID, their diaphragm is actually stuck. And we are not getting that, that movement of the diaphragm that invites a good breath. So it's something that we really focus on. When you use your diaphragm to breathe, you're actually stimulating your vagus nerve because your vagus nerve is innervated with your diaphragm. And it also allows all the air to get to the bottom of your lungs, which improves gas exchange. It slows your breathing, and your diaphragm works as a support for your posture. So when we're sitting a lot or we're not doing activity, a lot of people with long COVID get back pain. And by working on their diaphragm breathing, that really helps alleviate their back pain and gives them better postural support. And the other thing with diaphragmatic breathing is it helps calm your mind. And as an aside, just going to talk about some other things. The diaphragmatic breathing works as a massage for the inner part of your body. So we've got so many organs affected by long COVID. And when we diaphragm breathe, the muscle is moving up and down. It's actually giving us an inner body massage. So it massages your stomach. It massages your liver. It massages your intestine. And it also helps move lymphatic fluid through your body. Now, your lymph system is something that gets rid of toxins, and it doesn't actually have its own pump. Your heart pumps your blood, but your lymph doesn't get pumped by anything. So when we focus on this diaphragm breathing, it actually helps move that lymph. It helps improve lymph drainage, which then gets rid of some of the toxins that build up in our body. So what I'd like you to do is we're going to do a little bit of diaphragm breathing here. So we're going to make sure that we're sitting up straight. We're going to put our hand on our chest, and then we are going to put our other hand on our belly. And you can do this with your eyes closed or open. And what I want you to do is focus on that nasal breathing. And as you breathe in through your nose, allow that breath to get down into your diaphragm, and your lower hand will move out as your belly expands. And then as you exhale, allow that hand to return to its starting position. So as you close your eyes, just focus on that breath, moving your lower hand in and out. So thinking of that diaphragm as a muscle, and really thinking about that relaxed exhale. So just allowing that air to leave your body. So once again, this is something that could be done sitting, it could be done laying down, or it could be done walking. I'm just going to allow you to continue to breathe like this, but focus on that lower hand just moving with your breath, keeping your upper hand and your chest nice and quiet, keeping your shoulders relaxed. And then just check in to make sure that your saliva is increasing, the shoulders are down, maybe your stomach is rumbling, and maybe you're feeling a little bit calmer. Those are all some of the benefits of diaphragm breathing. And open your eyes, and we're going to continue.
Okay, so we're going to go kind of straight into our next exercise that we're going to do tonight or this morning, depending on what time of day it is in your time zone. So left nostril breathing is another one that we use a lot in our classes. Although actually the one that Vikki's just done, the diaphragm breathing, is my absolute favourite go-to exercise. So I was kind of gutted that I didn't get to do that one. So left nostril breathing. So again, if you feel comfortable doing so, gently cover your right nostril. This can be done sitting, lying, whatever you are most comfortable doing right now. And as with all of our exercises, if you start feeling any feelings of panic, anxiety, like you're not getting enough air, just take that finger off and resume your normal breathing. And then you may feel comfortable just popping it back on again at some point. So please listen to your body. So as I said, just gently, if you're able, cover your right nostril and just breathe as gently as you can through your left nostril. So just inhaling and exhaling through that left nostril. Now this is a really cool exercise because it really quickly activates that rest and digest state. So like we were saying earlier, rest and digest is where we want to be. We want rest and digest in the driving seat, so to speak. Other states, very useful, very important, but this is where we want to be. And this is a very effective way of getting us there. Now, if we were talking earlier about our different states, if you find yourself very, very firmly in your fight-flight zone and your breathing is really fast and your heart rate is really pounding and you're feeling pretty sort of that adrenaline feeling that we can get buzzing, it's pretty scary when you're in that kind of position, when all those symptoms are kind of hitting you head on. This might not be the exercise for you in that moment, because if you cover your nostril, you're reducing the amount of air you're breathing by 50%, which isn't a bad thing, but this might not be the way to do it in that state. So we may need to hit up some of the other exercises first. This is where it's really important to start to understand our own bodies, our own symptoms, how our body responds in all of these different nervous system states, and how that looks like on different days. Because as we all know, long COVID does not look the same on a Monday as it does on a Tuesday, for example. And things can change hour by hour, minute by minute even. So again, if you're comfortable doing so, keeping that finger on your right nostril, so you're breathing through your left. And the really cool thing about this is that your left nostril is directly related to the parasympathetic nervous system. So left nostril, right brain, effectively. Now, I normally go down the big tangent at this point onto the neuroscientist called Jo Bolte-Taylor, and I'm not going to do that tonight. But I would highly, highly recommend looking up her presentation. It's called My Stroke of Insight, and she talks a load about the difference between the left brain and the right brain, and it's absolutely fascinating. So we're just going to do this for just another few seconds with our left nostril. And just as you're breathing there, just check back in with your body. What's showing up in your body? And remember, there's no right or wrong thing to be feeling. This exercise may not be your best friend, or you may find that you really, really like it. And that's why we teach lots of different ones. So just check in with that body. What is showing up? Are you noticing any saliva in your mouth, for example? Are you feeling a sense of calm? Is your heart rate slowing down at all? Tummy rumbles, warmer hands and feet maybe? So any of these things, just noticing. And if you'd like to drop anything in the chat, if you want to share if you are noticing anything, then please do. Yes, Jo Bolte-Taylor, My Stroke of Insight. It is a TED Talk. It's on, if you Google it, it will come up. Okay. So again, if you're enjoying the left nostril, feel free to keep doing it. Or if you feel like you want to give your arm a rest, then again, that's absolutely fine, whatever works for you. So let's talk a little bit about pacing. And this is definitely one of those words that makes a lot of us go, oh, I think, certainly for me, because it is not fun. It is not fun having to pace. It is not fun having to decide what you can and can't do by this sort of very small feeling energy envelope. And like everything else in life with long COVID, we need to pace our breathing. So when we've done a breathing exercise, we need to always finish with that gas in the tank. So could we do that again? And if you feel like the exercise that you've just done, it's been quite a lot of hard work, then maybe we need to do just a little bit less of it next time. And that is part of learning our own bodies. But also that little and often is better than a longer session. I always give the analogy of teaching music, which is what I did in my former life. So I taught music to a lot of people. And every week people would show up, and it would be so obvious that they hadn't touched their instrument all week. And then they'd got it out the box the night before because they'd gone, oh my goodness, I have a lesson tomorrow. I'm going to do an hour's practice, and she'll never know. And then they would show up the next day, and I wasn't born yesterday. I know all the tricks in the trade because I did them when I was a child as well. So if you do all of your practice the night before, you're not going to see the same amount of improvement. And the same thing goes here with breathing. Little and often, is much, much better than one longer session, partly because you're getting that consistent effort. But actually with long COVID, in terms of pacing, if we do an hour's worth of breathing exercises, that's probably going to be too much anyway. So little and often is going to show much, much more improvement. But also, don't give up. I think we've all had this experience where you find something and you do it a little bit and you think, oh, did that work? I think that might have worked. And then you try it again the next day or the next week and it doesn't work, or it doesn't have the same impact. It is working. It will take time. If we're talking here about changing our nervous system, we're talking about changing the functionality of how we breathe. These things do happen, but they do not happen instantly. So you will notice improvement over time. And hopefully some of you noticed something happening in these exercises that we did tonight. But over time, they will make even more of a difference. Unfortunately, long COVID recovery is not a linear thing. And then, the other thing, you can increase or decrease the frequency and timings and the amount of exercises that we do. So we need to listen to our own bodies, and how much we did yesterday isn't necessarily going to be the same as how much we're going to do today. And this is something that we talk about a lot in our classes. We don't necessarily increase anything this week because it was a certain level last week. We only increase if our body says so. And sometimes it's not that we increase, actually, sometimes it's that we decrease. And unfortunately, that is just one of those frustrations, but it's really important to understand how to work that out. So this is just a few things that we offer. So I should also say that we have lots and lots of free resources on our YouTube, our Instagram, and our Facebook, which I'm going to share at the end. So there's tons and tons of stuff out there that we've got, as well as this workshop that we've done tonight. But what we also offer is that we have a 6-week, 12-session breathing course. Our next cohort starts the week of the 4th of March. And this has been one of the most fulfilling things I have ever done in my life, is working with some of these people who come along, and we work our way through some of these exercises. We share our experiences and that kind of community feel that we get. We're going back to our rest and digest, our social connection. When we have long COVID, we often feel incredibly isolated. We feel isolated from people we were working with because maybe we're not working anymore. We're isolated from friends because we may not be able to see them anymore or do the things that we connected with them in the past. And often we feel isolated even from people we live with in our own house because they don't understand us. They don't get what we're going through, even if they are empathetic and understanding and very, very lovely people. So it's such an isolating experience. So this course, as I said, starts on the 4th of March. The next cohort, we have a couple of different time zone options. We've also got a couple of workshops coming up. So the first one on menstruation and long COVID. So we didn't really talk about this very much tonight, about how the impact of hormones on the autonomic nervous system, hormones on breathing. how can we work with that? What can we do in the context of long COVID? Because this is something that a lot of people have noticed. So that is coming up on the 12th of February, and then our similar one on menopause and perimenopause on the 19th. We have a monthly Come and Breathe with Us session, which I did a couple of weeks ago, I think, and it was absolutely delightful. You literally come and breathe with us for half an hour. It's on the final Monday of every month. And we also offer one-to-one coaching. So all of these options are available, more information at longcovidbreathing.com. So hopefully that's a nice, easy one to remember, as well as you can email us at longcovidbreathing@gmail.com if you have any questions or just anything you want to say to us. We love to hear from people. If you've got suggestions, questions, just anything. I can't find the link, please help. Just drop us an email. We will be very, very happy to help. So I think that's all I had to say, and I was going to pass over to Vikki, who is going to probably make us both cry.
We're only going to make ourselves cry because, like Jackie, teaching these courses has just been so fulfilling to me. And the testimonials that we get from our clients and that sense of community and support and the accountability that they feel with each other has made a huge difference, not only in their lives, but I can honestly say it's made a huge difference in my life. But what we've done is we've really taken the guesswork, the trial and the error out of the myriad of breathing exercises that are out there. And we are so sensitive when we've got long COVID, and having exercises that are tailored specifically to long COVID is so important. And having a toolbox. So as we've talked about, there are different symptoms, there's different situations that we encounter as we go through this journey. And knowing when to use exercises, having that ability to practice these exercises, because like Jackie said, we don't want to just show up with a relapse and then think, oh, I think I'm supposed to do some left nostril breathing at some point. But that's what we make our clients accountable to. And they are, like I said, we've modified them to support you. And it really is a life tool. Jackie said it, she's recovered. She still uses these breathing exercises, and I'm suspecting she uses a few more too. But, you know, our hope is that we recover. So during our recovery, we want to learn the exercises that are going to help. But after our recovery and our life beyond long COVID, these exercises will also be a tool for you. And that's something I think we all have to believe in. So I wanted to thank you all for your attention. I know sometimes it's hard to stay focused, but we appreciate you being here. We're sorry that you have to be here, but we're so glad that you took the time to just listen to us. And if you have any questions, we are happy to answer them, but we've got a little bit of time now. So if you'd like to raise your hand or put something in the chat, we'll start looking and answering.
Yeah, there's one I've just spotted in the chat there that says, I find it nearly impossible to nose breathe when I am standing or walking, so I can't exercise. This was definitely something, you know, when I first realizing that breathing was something that you could do incorrectly. I think, you know, many of us aren't aware that breathing is even something that you can change. Certainly that was what happened to me to start with. And then when somebody said to me, how are you breathing? And it was like, isn't breathing an absolute? You either do or you don't. And as it turns out, it's a lot more complicated than that. But yeah, for me, it took time. I think, you know, it always takes time. If we don't breathe through our nose, when we then start to breathe through our nose, it doesn't happen instantly. You know, we have to do it a bit gradually. So the more we can breathe through our nose, the better. And then as we start to breathe through our nose more, then we are able to then, you know, breathe through our nose even more. And then as you start moving around a bit, again, just doing it really gently. What I found useful was if you're moving around and you feel like you can't nose breathe, can you move a little slower? Can you move slow enough that you can? And sometimes you can, sometimes you can't. But certainly that was helpful. I don't know if Vikki has anything to add to that, but it is
I
definitely
do
a
have
process.
something to add. Of course I have something. I do have something to add to one of the things. So we do offer a course that is breathing techniques for long COVID athletes, and it is focused on people that had an exercise routine prior to long COVID. And once again, it's that sense of community, that people have that shared interest. And one of the things that we teach, both Jackie and I, is if you are out there exercising and you cannot breathe through your nose, you're exercising too hard. And we all know what PEM is, post-exertional malaise. We have to be very careful. And that's why when we learn to nasal breathe and when we learn to start using our diaphragm, then we can start adding some of these exercises into walking. But like I said, not overdoing it, and pacing is so important. But there is a place for nasal breathing and walking with long COVID recovery. But like I said, be very aware that if you cannot nasal breathe while you're exercising, I would caution you that maybe you are exercising at too hard of an intensity for your very delicate long COVID body.
Yes, absolutely. I'm just trying to scour the chat. I do nasal breathe as a default, but I hadn't noticed I can't diaphragm breathe. Yeah, this is definitely something that we notice. And I think being conscious of it is the first step to changing it. Like I said a moment ago, I didn't realize that you could breathe incorrectly. And then suddenly when I realized that you could, it was like this whole door got opened to all of the different, you know, it's the things that you know that you don't know, and the things that you don't know, isn't it? So once you realize that there are things you don't know, and then you're able to start looking into them. So yeah, absolutely. Breath up, being awareness of the breath. How are you breathing? Am I using my nose? Okay, great. Yes, I'm using my nose. Am I using my diaphragm? No, not so much. Okay, what can we do here? Yeah, definitely. I think for me, I
And
find
I'm
it very
gonna,
difficult to diaphragm breathe sitting up. So if you're struggling with the diaphragm, try it lying down maybe and pop a hand on there. That kind of muscle mind connection can be really helpful there. So yeah, lying down much easier probably. Pop a hand on, or you know, a book, like a light book, not like an encyclopedia. Or even there's a picture of me on our Instagram, I think, the other week, where I was using an octopus wearing a Santa hat, sitting on my diaphragm, because I thought, well, this will give people a laugh, won't it? But yeah, just popping anything on there, that certainly could be helpful. Sorry, Vikki, I think you were about to say something else.
I was just going to say that, you know, in the course that we're teaching right now, diaphragmatic breathing has become so important that I think we spend 3 or 4 classes working on that diaphragmatic breath. We work on exercises to unstick the diaphragm. We work on exercises to improve that strength of your diaphragm muscle, because it's one of the things that with people with long COVID have a lot of difficulty with. And to focus on it is something we can do. As Jackie said, you can change your positions, but it's it is the go-to exercise that we use because that muscle provides so many benefits to your body. So that was an aside.
Yeah. And you know what? Just jumping on to what you just said, Vikki, what can we do? This is such an important thing. It's so important that I have it stuck on a post-it on my wall. So anyone who's a podcast listener will be very well aware of my post-it wall. And this is right in the center. Don't let what you can't do prevent you from doing what you can. We're all all too aware of what we can't do with long COVID because it is literally bashing us in the face all day, every day. We can't. So what can we do? And actually, as it turns out, there is so much that we can do. And breathing for many people, for most people, I might even say, is a huge part of that. There's a couple of people with their hands up. So if you want to jump in, I'm not sure who was first. And I also have no idea how to pronounce your name, so I'm really sorry if I'm doing this wrong. Is it Shweta?
Yes, this is. I have a question regarding this sleep. So one of the things that I'm experiencing post-COVID is that if I get up in the middle of the night, so I usually sleep at 10, but then I see a pattern that between 1 or 3 sometimes I get up, and then if I slow down and sleep back again, I actually get a better breathing and a better response from my body and feel more relaxed. Do you have anything to say about having this kind of a pattern where actually I consciously have started interrupting my sleep? Like I sleep for at a stretch for 4 or 5 hours, then I take a break, I intentionally get up, do a little bit of breathing exercise, and then go for another 3, 4 hours of sleep.
I think disturbed sleep is very common. I mean, again, we can't give advice on anything beyond breathing, but there are all sorts of other things to look into about waking up in the middle of the night with sleep. But I mean, yeah, downshifting, down regulating the body before sleep. Vikki was talking earlier about the pre-sleep routine, finding an exercise that really works for you. We teach all sorts of different exercises, and I think they will all work in different times for different people, but which one is the one that works for you before sleep? I know for me it is just bog standard simple diaphragm breathing. That's what I do before sleep. The other ones, they don't work so well, but that one really does. That's for me. So, the better our breathing, the better our sleep is, the more likely we are to wake up. But if we do, also then allowing that we can get back to sleep afterwards, what's your exercise for the middle of the night when you do wake up? Having that kind of like teed up and ready to go, for if it does happen, I suppose. And that comes back to knowing what exercises to do and when. Do you have anything to add, Vikki?
I was just going to say that sometimes if we do wake up in the middle of the night, it is because we have returned to mouth breathing. Or our body temperature has increased. And some of those things obviously have an effect on our body that wakes us up. Ladies going through perimenopause or menopause often wake up in the middle of the night with that upper chest breathing. So when we hyperventilate, we tend to wake up. And so it is interesting because I have seen people that have actually caused them or set alarms so that they could check in to make sure that they are continuing to nasal breathe throughout the night, to make sure that they're waking up feeling refreshed, because like we've mentioned, the sleep is so important. There's a lot of people with long COVID that actually wake up with asthmatic symptoms. They have long COVID sleep asthma, which is different from sleep apnea, but it's something that comes along with long COVID. And we certainly touch on those exercises during our courses, just because we are also very different. I think Jackie said that she uses certain exercises. I know with my clients that they all have their favorites. And sometimes we have to be our own guinea pig. We have to play with our sleep schedule or play with our breathing exercises to find the ones that really suit our bodies. And that's why by just giving options to people is so important, because like I said, long COVID is different for everyone. The breathing exercises that will work for you are also very different.
Yeah, absolutely. Patrick Ford, you've got your hand up. Is that a question there? Do you want to jump in?
Hi, can you hear me?
You're quite quiet, but I'm just getting you.
I don't know how to turn the volume up, but can you hear
It's
me?
okay. You're good.
First of all, I'd like to say thank you to Vikki and Jackie for doing this presentation. I'd like to say hello to Patrick McKeown. He will know me as Pat Ford from Cork. I did the courses with Pat for 12, 14 years ago. I did many classes with him.
I can't actually hear anything.
I'm getting it.
Can you hear me?
Yeah, keep going. I think Vicky's maybe not quite getting you, but I am.
My control files.
I'm just going to say hello to Courtney, and because she's asked how to sign up for the February workshops. If you go to the longcovid.com, longcovidbreathing.com, it's on our link tree. So you'll see that there's a sign up for the menstruation and menopause workshops. And I can also send you that information via email.
Yeah, Patrick, I'm sorry, we're really struggling to hear you. Are you able to type it into the chat at all? And we can read it out. If that's possible at all. Sorry. I've just dropped our link into the chat as well, longcovidbreathing.com. That will take you to all of our different links. Yes, we are getting you better now.
As I said, I did a course with Pat McKeown about 12 years ago. He brought my control pause up from 8 seconds up to about 25, 30 seconds. I had a problem with panic attack, anxiety, and a stammer. I got my control pause up to 25. All of those vanished. A lot of the stuff you covered this evening, I have been doing it for years because I read all Pat's books and I've been on to Pat a few times. I would like to find that I had terrible COVID for about 6 weeks, and I don't really think that I have long COVID, but I would like to ask you about brain fog, because I feel that my memory brain is not great at times. It's a bit slow. And could you just give me an explanation as what brain fog is, please?
Oh, what is brain fog? I mean, I think like every other symptom, like long COVID, it's different for everybody.
I'm going to jump in and say,
yeah, Vikki,
I'll give
you've
you
got
a
personal
really
experience of this.
great example of brain fog. I can remember when I was suffering at the beginning, and the inability to find words. So I use this example. My husband had a bowl of fruit, and I couldn't identify with words an apple, an orange. Those words I couldn't find. Another thing that I've done with long COVID brain fog, gone shopping, been walking around the store, and realized that I'm still in my pajamas and my slippers. And those are things that, you know, our cognitive ability changes, and we often sort of just aren't focused, but those are examples of brain fog, not being able to find words, not being cognizant of our daily routine and how we're supposed to do things like brushing our teeth. You know, these are things that were learned before, and for some reason, when we have long COVID, we suddenly aren't able to do that. I will say, though, that some of the breathing exercises have really helped with brain fog, just because when we do the appropriate exercises, then we get more oxygen to our brains, which helps us think. So that really alleviates the symptoms of brain fog.
I think I actually have brain fog. That's not true.
Yeah. It looks different for everybody, you know, and like every symptom, we've got a sort of sliding scale of severity, I think. You know, I was quite lucky. Brain fog wasn't really an issue for me, but then when I got very fatigued, then I would struggle for words. And if you ask my partner, he will tell you that I never struggle for words, other than having too many of them. Whereas, you know, some people, as Vikki just described, you know, will you know, just it's almost like someone's turned the brain off, and others will, you know, struggle with sort of word finding, and so yeah, sliding scale, unfortunately. Yeah, there's a few people putting some examples in the chat there. So yeah,
Thanks, Vikki. That answers my question. Thank you.
you're very welcome.
Will you be showing people how to increase their control pause?
The control pause. Do you want to take this one, Vikki, or shall I?
I'm happy to take it because we don't do it. Simple as that. We are very cognizant of the fact that long COVID recovery is not linear. And the symptoms that we have during long COVID are very different for everybody. And for us to focus on a number or an idea that if our control pause is increasing, then we should feel better. And that isn't the case. So, you know, long COVID is a lot about feeling let down. And I think when you put your focus on something that could be erratic and not linear, then that's why we don't use it. So I would caution people to say, don't focus on the control pause, because if your control pause goes down and you're doing your exercises, it may cause you to withdraw from doing those exercises because you might think that they're not working, but they are working. It's just the way that long COVID happens in our body. So that's one of the reasons that I don't use it with my clients. I know Jackie doesn't use it with hers, just because we don't want to set people up for disappointment and failure. And on a very personal level, I have had long COVID now for 3.5 years, and my control pause or BOLT score still bounces around. It started at 3 and it bounced around, got up to 15, and then, you know, it's just very erratic and it mirrors long COVID. And I think we want to move away from things that are mirroring long COVID. We want to have that constant pillar of nasal exercises that help with our recovery.
Okay, thank you. Thanks, Vikki.
Yeah. And actually, to add to that, I think we know if people have breathing that is really, really, you know, very low control pause. When I first started doing breathing exercises, my control pause was like 2 or 3. And actually, when I did that control pause, that put me into a panic attack just trying to do it, because holding my breath even for 2 seconds was too much. We don't want to risk doing that to people. And we know how bad their breathing is by looking at them if they're like that. So we don't want to risk putting people into that position. We know that the breathing will help. And, you know, maybe the control pause does become useful at some point, but we definitely feel that, you know, for what we're working with, it doesn't. There's another question. Is it Eamon? Again, I have massive apologies if I've pronounced that wrong. Feel free to jump in.
Okay, no, you're fine, Jackie. That's good. Can you hear me okay?
We can.
Yeah, it's just I tend to mouth breathe. I'm only getting into nose breathing, but I find it hard to continuously do the nose breathing. Is that something that will come eventually that I get used to doing and not mouth breathe anymore, or how does it develop?
Yeah. So again,
It
this
develops.
sorry, Vicky, on you go.
Okay, I was going to say it develops as you strengthen the supporting muscles and practicing. It's like if you've been mouth breathing all your life and then we suddenly ask you to start nasal breathing, it does feel foreign. It feels strange, but we're very gentle when we teach this nasal breathing.
Yeah.
And we're very gentle when we start talking about strengthening the diaphragm, which will then help you nasal breathe. So we do things to support your body's ability to nasal breathe. But I would liken it to something like if you have been doing something in a certain way your whole life, and then someone says, you know what, let's change this. Let's do something completely different. We take a while to adapt. Our bodies take a while to adapt, and sometimes we fight it. But we're very gentle. We need to be gentle with our body. But I will tell you that most of us came into these breathing with this upper chest breathing, the hyperventilation, the dysfunctional breathing. And slowly but surely, we have moved to the 100% nasal breathing. So to answer your question, it will feel strange if you haven't done it, but to stick with it and to be gentle with yourself as you explore the exercises.
And on that, we'd say just finally, which I'm not sure that I ever consciously just exclusively was mouth breathing, because I was very athletic and, you know, played lots of golf, football, running, skiing, everything. And it's only last year I started gasping, and because I haven't been able to do any exercise, I couldn't walk 100 yards now, and I've lost 12 kilos. So I'm down to just over 10 stone. I was over 12 stone. Is that unusual that something like that would happen?
I think it's very usual. I think a lot of people that come into COVID and then long COVID, you know, the people that were athletic before were, I know I was a mouth breather, you know, I was a runner. You could hear me coming, you know, from 100 yards away because I would mouth breathe. I was a very loud breather. And, you know, that was something that I changed. And you know, if we move away from long COVID and look at the people that are exercising and trying to improve their performance with their exercise performance, they are now switching to nasal breathing. So I know we're talking about it here for breathing for long COVID, but there's a whole discussion about breathing for people, performance breathing for exercise, and it is all nasal breathing. So what I would do is I would just encourage you to just keep doing it. It's something like, you know, when you started running, you couldn't run a half marathon, but you trained at it. You added stuff in and you saw the improvement. And it will be the same with your nasal breathing, you know, switching from mouth breathing to nasal breathing. And it will also support your recovery, because if you're out there breathing and with your mouth, you're not supporting your recovery. You're keeping your body in that fight or flight.
Yeah, absolutely. Yeah. Someone's commented in the chat about, changing patterns, using the example of moving a watch from one hand to another. And it does feel wrong to start with. So that's a really good point. You know, you're changing the biochemistry of your body. So it will take a bit of time. There's one that I missed earlier, which actually is quite interesting. I love questions that I have to think about. So this one is noticing with biofeedback that my heart rate variability is higher and better with chest breathing than with diaphragm breathing, which I interpret as chest breathing is less stressful for me right now. Do we have thoughts on that? And would strengthening the diaphragm with exercises be of help? So, I mean, definitely if we think about, the diaphragm as a breathing muscle, in fact, the biggest and most important breathing muscle, if you train any muscle, it takes a bit of time. So, you don't go from not running at all to running 5K overnight. So definitely, building things up, like we were saying earlier, pacing our breathing exercises. So, if you're doing diaphragm breathing, do it for 30 seconds, give it a break. Do it for another 30 seconds, give it a break, for example, to kind of pace it yourself. I don't know, Vikki, I'm sure you have thoughts.
I do have thoughts. When we're not able to use our diaphragm, and if you think about your diaphragm and the amplitude of the movement of your diaphragm, if we're not getting that full movement, what actually happens is we push our breathing back up into our chest.
Yeah.
So that's one of the reasons that we spend time strengthening your diaphragm, because if it's not moving, if it is stuck, you will keep upper chest breathing. And I'm sure that if you were breathing with your nose and breathing with your chest, you would see an improvement in your heart rate variability. But that is not the efficient way for your body to exist. Your efficient way is to use that diaphragm. And there's always that leap of faith where you have to say, you know what, I'm just going to focus on this because I know this is the best way for my body to perform and to recover. So that would be my thing about heart rate variability. We do, the diaphragm, the vagus nerve, some of these breathing exercises, if we're using our diaphragm, will improve our vagal tone, which will in time increase our heart rate variability. And that's just one of the buzzwords right now. But heart rate variability in a nutshell just allows us to see how tolerant our body is of stress. And by improving our heart rate variability through breathing, then we improve our body's ability to deal with stress. And the way that Jackie and I look at that is by doing exercises, breathing exercises that improve our vagus nerve, our diaphragm strength, and therefore giving our heart rate variability a time to improve. And we talk with our clients about monitoring something like heart rate variability because it's an indication that your body is not dealing with stress. So there are certain numbers that we talk about that say, if that happens with your heart rate variability, be gentle with yourself. Caution, all these things that we don't have that biofeedback on, but heart rate variability is one of those things that we can turn to see what's going on with our body.
Yeah, absolutely. I mean, I suppose it's like, and again, if we use the running analogy, if you go for a run, your muscles hurt, but it's kind of good for you in the long run. Even if it hurts in that moment. Again, we're not suggesting anyone with long COVID goes for a run. It was just a slightly unfortunate, as it turns out, analogy that I cool. I don't see any more questions, and I'm very wanting to be respectful of people's energy and everything. So that's probably a lovely place to wrap it up. Thank you, everybody, so much for joining us. It's been a real pleasure being here and talking to you about one of my favourite subjects, which is breathing, and to share the stage with Vikki as well. So A huge thank you to Patrick and everyone at OA for all of their amazing efforts and for giving us this opportunity. We really, really appreciate it. We believe this recording is going to get shared by Oxygen Advantage, I think probably on their YouTube, but we will share it on our socials when it does go live. If you have any questions that we haven't answered or that come up later on, please do drop us an email either via the socials on the screen or longcovidbreathing@gmail.com, and we will get back to you. And if you're looking for any of the links that we've mentioned, then longcovidbreathing.com will take you to all of them. So yeah, a massive thank you, and yeah, happy Saturday. I'm terrible at closing things out. I think I'm just going to press the button. Shall I just press the button?
Just press the button. When in whole.
I'm
you
just going to
both.
keep talking otherwise. So yeah, thank you so much, everybody. Take care. Okay, now I need to find the actual button, don't I? Oh my goodness, where's the button? Okay, there's the button. Bye, everybody. Thank you.